This week, the Ohio General Assembly finished up a new 2-year budget for the state and also took action on a number of other bills before adjourning for the summer. This update will briefly cover some of the key healthcare-related issues. First, on COVID vaccines. A majority of legislators wanted to do something on vaccinations to favor personal freedom or choice over public health requirements that are seen as infringing on individual rights. 2 efforts, with the most strident of these bans, were defeated. However, an amendment was successfully inserted into an unrelated bill on enrolling military children into schools. The amendment bans requirements for non-FDA fully approved vaccines in public schools or universities for students and employees. However, it does not apply to university hospitals. If the governor wants to veto this provision, he will need to veto the entire piece of legislation, and as of the recording of this update, there is no decision yet from the governor. The passage of the state budget, House Bill 110, includes a number of Medicaid reforms, but also has potential policy provisions as well. The most direct issue potentially affecting physicians being language that was inserted to allow medical care to be refused to patients based on the provider's moral or religious beliefs. Again, we are waiting for any veto decision by the governor. In other healthcare-related issues, Senate Bill 21 was passed and signed by the governor. This bill implements new stroke protocols for EMS to give guidance on the appropriate hospital for a suspected stroke patient. 3 bills were passed where we're waiting for the governor's action. House Bill 9, which would require a prescription for cough medication for any patients younger than 18 years old. It was passed last week, waiting now the governor's signature. Senate Bill 6 was passed, which put Ohio into the Medical Licensing Compact. This provides an easier path for medical licensure for physicians who want to practice out of state in a state that is already a member of the compact. By joining this compact, Ohio hopes to provide an easier method for physicians to practice medicine across state lines if they so desire. The bill was passed last week and is awaiting the governor's signature. And the last bill in this category is Senate Bill 113, which expands legalization of fireworks to the retail level in Ohio. Over the objection of a number of physician organizations, this bill was passed and is again waiting for the governor's decision to either sign or veto. There are bills that are on the public policy watch list at the CMA that have now passed in the House but are waiting action in the Senate. These 2 bills are House Bill 193, which would require an electronic prescription for all Schedule II controlled substances, and House Bill 122, which would ensure telehealth coverage in Ohio private insurance plans. This bill passed at the end of April and has not yet been taken up in the Senate due to the Senate's timing around its budget considerations. So hopefully House Bill 122 will receive attention when the Senate reconvenes this fall. Finally, there are 3 bills to mention where questions have come up from CMA members on the status of these issues. The first is House Bill 135, which is the inclusion of third-party payments in patient calculations for copays and deductibles. And the second is House Bill 153, which would prohibit medication switching for non-medical reasons in an insurance plan formulary midstream of a patient's benefit year. The CMA and other physician organizations are supporting both these bills and will continue to work to seek their passage when the legislature comes back in the fall. And the final issue to mention are scope of practice bills, particularly House Bill 221, which is the APRN Independent Practice Authority bill. This bill is in the House Health Committee, but is yet to receive hearings. As I referenced earlier, the legislature is now on break for the summer and won't return until the fall. The CMA's Public Policy Committee will be meeting on July 22nd to assess the status of these bills that we've discussed today, as well as talk about next steps regarding this legislation and any other issues. The meeting will be a hybrid meeting where any CMA member can participate either in person or can join remotely. For questions about these or any other policy issues, feel free to contact the CMA.